everyone. I'm Aminata Kalbalde, and I'm super excited to welcome you to this edition of the Ignition Hour, where we bring to you great entrepreneurs in an effort of helping you be ignited by their journeys and experiences, whether you are a young entrepreneur or aspiring to embark into that path. This game changer, that is the Ignition Hour, is brought to you by Craving for Development in collaboration with the 50/50 Group and ACATS, University of Sierra Leone, and is powered by Mitchcom, an internet provider that makes sure we have high-speed internet at the Ignition Hour series. That being said, I would like to invite all of us to project ourselves and imagine an Africa where the driving force of our youth is courage, engagement, and determination. At the Ignition Hour, we are on a mission of making that happen, and we are just getting started. Because we have realized that in Africa we need great entrepreneurs and many more innovators to do what it takes to challenge the status quo. Another projection that I think is worth doing is one where African people would not need to go abroad for medical services. Rather, we would be proud and trustful that our local medical services will be innovative, ethical, and human-centered. That being said, this afternoon's session is about Sierra Leone's health system pulse checking. And it's all the more important for us to discuss that because of the various challenges we have in the system, because of the rate of unnecessary death that we experience, but also because of the opportunities for social entrepreneurship that lie in the sector. As of today, we have great entrepreneurs, great role models in our midst. And the platform is so beautiful because it's perfectly balanced, gender and sector-wise. So we have private and public sector together here today, which is a promise of an inspiring but exciting discussion. So that being said, I would like to introduce them first. So we have on my left Dr. Essie Thomas Macaulay, who is the founder and CEO of Footprints Sierra Leone Limited. Dr. Suleiman Lako, who is the co-founder and the co-manager of Premium Health Services Sierra Leone Limited. And Dr. Manal Gazawi, who is the founder and CEO of City Globe Limited and No HEP Foundation. So please a warm applause for our great speakers today.
Dr. Essie Thomas Macaulay is the founder and CEO of Footprints Sierra Leone Limited, diagnostics, aesthetics, wellness, and weight loss, where medicine greets art. Experience in conventional radiology and consulting sonologist, endoscopist, and currently working on becoming a lower gastroscopist. Trained by trainers from the British Society of Gastroenterology, CEO of Footprints, she is the first Sierra Leonean medical weight loss physician and medical esthetician. She is passionate about providing higher standards in healthcare and health delivery with an eye for developing new health experiences in Sierra Leone. Dr. Essie is skilled in non-profit organizations, healthcare and healthcare service consulting, travel and emergency medicine, mentorship, public speaking and management. She is a health consultant for various hospitals and health facilities. She is a medical doctor and co-owner of the Q&D Medical Center, a family-owned medical business of 35 years of existence. Founder and Chief Administrator of Doctors in Action Sierra Leone Limited, a medical networking forum created during Ebola, initially set up via WhatsApp as a safe way for communication to save and protect doctors from getting infected. She is also a consulting physician at the Well Woman Clinic. She is a current member and a former executive member of Sierra Leone Medical and Dental Association and a member of the Sierra Leone Medical Women's Association. She published presentations at annual conference British Society of Gastroenterology and another abstract at the same journal 2019. She was nominated the Best Female Medical Practitioner by Sisters' Choice Award, both in 2018 and 2019. Dr. Essie is a wife and a mother of two wonderful children. Ladies and gentlemen, Dr. Essie Thomas Macaulay. Dr. Suleiman Leko is a Sierra Leonean physician with over 9 years of work experience in the fields of internal medicine, infectious diseases, and public health. He provides technical assessment and capacity development in HIV, TB, cholera, antimicrobial resistance, and infection prevention and control. Graduated with a Bachelor of Medicine and Bachelor of Surgery degree from the University of Sierra Leone, Dr. Suleiman is a member of the West African College of Physicians and holds a certificate in clinical management of HIV from the University of Washington and a Master of Public Health from the University of Central Nicaragua. Dr. Suleiman is an early career researcher with vast knowledge and experience in the management, prevention, and control of infectious diseases. He has provided consultancy services and contributed to the development of various policy documents on some infectious disease programs in Sierra Leone. He is a lecturer in the Division of Infectious Disease, Department of Medicine, University of Sierra Leone. At present, he plays a pivotal role in ensuring that high-quality clinical standards are maintained in the management of hospitalized patients with communicable diseases at Sierra Leone's main tertiary hospital. Dr. Suleiman is the founder and the current executive director of Solrica One Health Services. He has received several entrepreneurship training skills. He is experienced in waste management, poultry farming, vegetable and maize plantation. He is very passionate about One Health-related research, a concept that is defined as a collaborative, multisectorial, and transdisciplinary approach, working at local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. Dr. Suleiman is one of the directors of Premium Medical Services, an excellent diagnostic and private health institution in Freetown, Sierra Leone. Ladies and gentlemen, Dr. Suleiman Lako. Dr. Manal Gazawi was born and raised in Sierra Leone. She is a doctor in pharmacy, a public health specialist, and a consultant clinical pharmacist and diabetes specialist. She is an entrepreneur and the CEO of the award-winning pharmacy City Globe Limited. She is the first to change the face of community pharmacy practice in the country by introducing public health services like rapid diagnostic testing, immunization services, diabetes management services, and drug therapy problem solving. Dr. Manal is also a preceptor involved in the training of graduate pharmacy professionals. She is also a lecturer of the West African Postgraduate Pharmacy Studies and a health adjunct trainer with an NGO called Professors Without Borders. She is also an executive member of the National Drug Expert Committee of the Pharmacy Board of Sierra Leone, responsible for the reviewing and approval of protocols for clinical trials for Ebola vaccines and all pharmaceutical products. During the Ebola outbreak, she was the study pharmacist for the Phase 2 Chinese Ebola vaccine clinical trial in 2015, during which she was a co-author in Lancet Journal. In late 2018, she was appointed by the Ministry of Health as a consultant and hence became a member of the Technical Working Group of Clinical Experts of Sierra Leone, where she contributed in updating and formulating the National Standard Treatment Guidelines for 2019. In early 2019, she was also appointed by the Ministry of Health as a national clinical expert for detecting adverse drug reactions following immunization. She is the founder of the No Hep Foundation, a local NGO involved in mass awareness raising, screening, and sensitization to curb the spread of hepatitis in Sierra Leone. She is also one of the pioneers in awareness raising and sensitization in the fight against diabetes since 2013. Dr. Manal was awarded in 2016 as the most outstanding female pharmacist and in 2018 as the best community pharmacist of the year. Ladies and gentlemen, Dr. Manal Gazawi.
Don't be fooled by the young looks. It's a very able doctor that we have among us. Okay, so I would like to welcome the three of you on this stage. Today we are very honored to have you on our platform. And I would like to start with Dr. Suleiman, man first, for the first time. Yeah, can we have an overview of, just a short overview of Sierra Leone's health system?
Thank you. Good afternoon, listeners. I can start briefly than much introduction. But of course, from my introduction, it shows that I need to disclose some aspect. I am both a Ministry of Health worker, working with the university, as well as the private sector. So for conflict of interest, I think I must disclose that now. The health sector in Sierra Leone can be broadly be divided into two. That's what they call the public health sector and the clinical sector. The public health sector deals with the population health. That's when you look at the population at community level, the services that are being provided at that level are referred to as public health. There is also the clinical sector, where in those people in which interventions that have been carried out to prevent and control diseases are not working. So they go to hospitals. And sometimes they even go there, they are not very sick, but they may have some minor interventions that are provided. So that's what they call the clinical sector. Those people that go to health facilities, clinics, that's the clinical sector. The public health sector looks more encompassing. And some interventions that are provided in those situations include mass drug administration. We know when filariasis was a problem, that's the foot problem. When people were getting blind because of onchocerca, that's what they call onchocerciasis, that causes river blindness. As a result of that, those people are very poor. So they have to give them some drugs as part of mass drug administration. Those are some of the interventions. They give things like insecticide-treated net in a large population. That's the public health interventions. But clinical interventions are those that are sick. But when you look at the clinical aspect of it, we look at facilities based on different perspectives. We can say primary health facilities, secondary, and tertiary. So primary health facilities are those facilities that are present in our communities that provide services, common services like immunization, common ailments, like people that have fever, they can go there. And sometimes they also serve to prevent risk factors. Someone might have high blood pressure, but might not have developed a heart problem, might not have developed a kidney problem, or someone might have HIV, but might not have developed any structural problem. So they go there, they screen them and provide services. If at all there is a problem that has defined a heart problem, for example, or any other system problem they think they cannot handle, they refer to secondary health facilities. Those are hospitals like the Lumley Government Hospital, the Kiama Road Hospital. In Freetown, most they refer to them as satellite hospitals. Then if those ones have challenges, they go to a higher level, like Connaught Hospital, the Princess Christian Maternity Hospital, the cottage, what they refer to as cottage. So those ones handle complex cases. They are expected to have various expertise to provide solutions for conditions that are very difficult to handle at secondary level. That's one way of looking at it. The other way of looking at it is you can see those that are private facilities and those that are public facilities. They are private institutions that provide services, which are private facilities, we refer to them, and the public facilities. But another way is we have those that are neither private nor public, faith-based organizations. We heard of the St. John of God Hospital, that's the Medicinal Hospital in Lonsara. The UMC Hospital, that is the urban center. That's how people refer to them. Those are faith-based hospitals. But there are hospitals that are NGO-operated hospitals. For example, now we talk about the Aberdeen Women's Center, which is just nearby. Those are NGO-operated hospitals, the Emergency Surgical Hospital. Those are different hospitals that operate under an NGO umbrella. They don't do anything in terms of cost. You go there, services, most of the time are free services. But for now, the health sector, if you look at government is saying that we have about 1,300 health facilities across the country. So this is how the health sector is now at this moment.
Thank you so much for this overview. It's really clear and enlightening because I never had this clear, big picture of what the health service is. So now having this health, the big picture of the health structure, I would just invite us to watch a video that we developed while after visiting Hubei and Bome communities. And the way those people are living is something that we have identified as something that is a challenge to the way people are living, but also to the work that the health system is trying to do. So we would like to watch it together and then have these specialists analyze it. And Madam Abiba for the help they have provided in visiting these, identifying and also visiting these sites. So the question that comes to mind after watching this video for all of you is like, how safe are we as a population, and also how challenged are you as practitioners? We are like working in a context where these type of sites exist. Any of you?
Yes, this is indeed touching images which we're all familiar with, I guess. So, for example, these slum dwellers, we have 72 slum dwellers in the country, in Freetown alone, and they represent 35% of the population of Freetown. So definitely these slum dwellers or these slum communities is what is contributing to one of the largest public health problems that we're facing in the country, especially the infectious diseases.
Yeah. If I may add, your question about how does this affect us all. If we're to look at both the perspective of how long this has been going on for and how much we're behind in terms of setting up statistics, evaluations, doing something about it. It's generated a prolonged trend or lifestyle of disaster that we need to basically approach from various perspectives, both from the public and the private health sector, and also from the education, from the Ministry of Education, in develop strategic formats in getting ourselves, because this, you might not live there, you might not know someone there, but it affects us all because you have people you interact with daily that comes around you, or you go to work and they're there, and so you never know where the next disastrous communicable or non-communicable disease is going to start becoming a serious problem for our country. And we see pictures there of smoke inhalation taking place in one section, another one where even today in Freetown, we thought in the province it's still an issue, but even in Freetown, just several steps away, someone's doing something and someone's washing. You know, so that mentality, that level of education has to take place on a higher capacity, and we need to start from the grassroots, not just within the schools, but basically intervene from within the community. But also we need to make serious technical and how to say prolonged decision, which I believe like FCC, Freetown City Council, is already trying to change what we believe is the norm, because I'll tell you, for real, these people believe it's the norm. Once they're out of that zone, that's what they take out. That's why we're still laundry is still taking place in the street, and that's why the mentality of how we approach disease is an issue. Because we do have even doctors who develop from that community, and it's about time that we realize we need to embrace our faults and not hide them behind us for us to make the changes.
Great development. It's really true because, as you said, not only the fact that people are there looking, but then a mother would be standing there, see their kids using the green water and cleaning themselves, but it's like, it's not an issue at all. So the level of education that mother should have for them to be able to know that the kid is bringing disease to themselves. So of course it's a cost-cutting issue. It involves the environmentalists, the educators, the doctors, and the policymakers alike. Yeah, thank you for that. So what would you like to add to that?
I think, as most have said, it's actually a disaster, not just for them, but even for the health sector and for the general populace. If you look at this situation, that's a hybrid for various diseases. There are some referred to as infectious diseases of poverty. A situation like that can serve as a hybrid for malaria, that's vector-borne diseases, diseases that are spread from one person to another through the bite of a fly, or maybe the movement of a fly from one point to another. It's a source for diarrheal diseases, those diseases that you can acquire through by taking them from hands. People are defecating there, and you can see one man wheeling from the water. Potentially, there are other diseases you can get from that. Like there are those that can affect the liver. We call them schistosomiasis. So usually they take opportunity when you wade on water, barefooted. So a lot of other diseases are acquired by that. And if you look at what we have at Connaught Hospital, for example, if you go to the chest clinic where we provide TB services, there was a time I wanted to do some interventions, public health interventions. Realized that most people that have TB are coming from this facility. And most people that are having HIV are coming from those slum communities because they live in an environment that is crowded, which is a risk factor for TB. They live in a situation in which they are vulnerable. So it's a reflection of poverty. It's a reflection of how poor we are. So the overall goal is actually how we can address poverty, how we can make people be more formidable. They are able to handle their own issues very well. That's the challenge we have. This is just a reflection of poverty, a reflection of lack of education, a reflection of the fact that we are economically deprived. So when you see this situation, you know we are at the bottom of human development index. So for us, it's a challenge. For you also, it's a challenge because some of these diseases can spread. This can serve as a nidus for the propagation of cholera. So an outbreak can occur, and then it can then spread like that. So women can become affected because they may not have optimal measures to control water. So it's not just for the health sector. It's not just for these people, but for all of us. How we can look at interventions that we will serve to control this one. It left with us as entrepreneurs. It left with us as young people. So when you look at this, there are aspects of social entrepreneurship that you can bring in. As long as you are credible, you look at all those issues, you'll be able to make an impact. And some of them are actually on our side. We are passing through those phases. But that's why I say education has to be useful. You see, there is no way you just go to school, you get a job, you forget about the poor people. We have people in our community that we don't interact with to see how we can change their mind in the way they think, to see how we can change the way they behave, which are key factors that help in the spread of disease. And Dr. Ese said it, some people are coming from there. They are now more or less people that are well placed in the society, but they are not going back. We just criticize the system. So we need to be innovative about how we handle these issues.
Great analysis. Thank you so much for that. And thank you for the invitation to social entrepreneurship, because of course where lies the problems is where we have opportunities for entrepreneurship. That being said, this is something that favors many common diseases that we have among us. Like we have a very large spectrum of common diseases that range from malaria to typhoid to cholera, you name them. I would like to know how ready and how equipped the medical service or the medical staff is to address those illnesses.
Yeah, so I must say, to some extent, we have some aspect of awareness, and to some extent, we also have lapses that requires interventions, that require actions from those that are aspiring to become entrepreneurs or from entrepreneurs. These conditions are killing a huge number of mass. For example, malaria prevalence now is about 40% in children below the age of 5 years. And those are people at risk. They are vulnerable because their system has not developed much. So as a result, if you don't make any form of intervention to prevent or get malaria, to treat them early, most of them will die. And that contributes significantly to what is referred to as infant mortality, what is referred to as bona fide mortality, which is why we are at the bottom of the human development index perpetually. Just look at it, we have 35% of the population in the western area living in such communities. Poor sanitation, so those are all potential things. So you ask ourselves, are we really ready if we have this situation? Then it means we are not fully ready. Even if we are prepared, we might just have psychologically satisfied ourselves. If we don't address these issues, we will not be able to address the challenges that are posed by this problem. Another issue is that these are areas of overcome. We have to look at these diseases in relation to public health. People, about 10 people can sleep in one room, 5 people can sleep in one room. When you have this situation, if someone has an infectious disease, for example, tuberculosis, which we refer to as dry cholera, potentially what will happen, that person can spread it. If we don't address those social issues, then we are not ready. If we wait for people to sick before they come to us, then we are not ready to handle those issues. So, the public health intervention, even that, we do provide some, but we still need some aspect that that you have not been able to handle. The aspect of diagnostic. This condition, before you make a conclusion that the patient has it, you have to make a diagnosis, and it has to be confirmed. For example, typhoid. We are giving everybody say, I have typhoid. And even the interpretation of the result is a difficult thing. So when you say we are prepared to handle typhoid in a situation like that, I can say no. We don't have the ability to make a diagnosis of typhoid in this country. As of now, something that can say, oh, appropriately, I have made a diagnosis of typhoid. So these are all potential areas that we can look into. We can see how we can work with communities. We can see how we can work with organizations as social entrepreneurs. You know, there is poverty. I can tell you, these diseases that she called, 3 of them are part of what we refer to as the big three. The big three in relation to infectious diseases of poverty. If you say you want to make an intervention that has to do with getting money from this type of people, it becomes a problem. But when you look at interventions that create NGOs, or they are what you call corporate NGOs. Corporate NGOs, those who can pay for the service, they pay for them. They will source for resources somewhere to take care of the general population. And that is what is referred to as social entrepreneurship. So we need to explore those areas as entrepreneurs to help the government system. And even the aspect of establishing private laboratories, which is very crucial. No one can look at it and see how we can improve diagnosis of typhoid. If we can't diagnose typhoid, and majority of the people are saying, I have typhoid malaria, I have typhoid everywhere. Everywhere you go, people are giving themselves typhoid, which in fact, to a large extent, is not existent. We can't say we are a prepared healthcare sector, but that's a source of misuse of antibiotics, which is a potential problem that they believe will kill millions of people if we don't do something by 2050. I'm sure we are partly prepared, but to a large extent, we have more to do as people. That's the summary I can give.
Thank you so much for that summary. And I thank you also for the honesty, because the picture you have given is, I think, one that most of us are familiar with. And I have a concern about that, because I know so many people who go to the hospital and come back with typhoid treatment, and you just informed us that there is no appropriate, let's say, system or material that helps identify the sickness. And all those are challenges that the health workers are faced with. So, Manal or Essie, would you want to?
Yeah, I'd say Dr. Lako has said most of what I wanted to say. But just as he mentioned again, I would like to throw light on some of the few aspects he has mentioned. Like, for example, the diagnosis of typhoid fever is a very big public health challenge, in that because of the use of the diagnostic tool, which is not too accurate or not sensitive or specific. So you might have another ailment manifesting with fever, then that test is interpreted as positive, contributing to antimicrobial resistance, which is a global public health issue. So also, since among those diseases you mentioned, there's also hepatitis. We're far behind in the management and the prevention of hepatitis, and the diagnostic tools are hardly available nationwide, and also the treatment and preventive measures are also missing. So also, if we tackle the slum community, for example, that will contribute largely to reducing these infectious diseases that we're having. And for example, pneumonia, through the burning of these communities, I mean the garbages will contribute to lots of respiratory diseases. And I'm sure the slum community, which represents 35% of the Freetown population, if they're continuously being affected with these infectious diseases, it's definitely the child and newborn mortality is also, I'm sure most of these people are included in contribution of the increased maternal and child mortality.
Thank you so much. And that's so true, because of course babies live in, or children who are under 5 live in these communities, and they're really very fragile and they cannot cope as adults can. Dr. Effie?
Pretty much, I don't want to like go over emphasizing the same thing because we both are on the same path, him as an infectious disease specialist as well. But the foundation of seeing what the reality is, as I mentioned already, is impacting us whether you like it or not. And as individual efforts from younger people as yourself, it's so good to see so many young people sitting here interested in business, entrepreneurship, and there's no true way, no true chapter to start. Your innovativeness, your focus into specific areas of interest or collaboration, which is something we also need to start looking into, collaboration as young entrepreneur, because until we learn to do that, I see it's a thing that Sierra Leoneans suffer a lot. Everybody wants to be the hierarchy in everything. So when we start collaborating, we work better in development and put us basically at par with neighboring countries, because younger people as ourselves have involved themselves in changing the narrative of their community, even at this early age group. We can involve people within that community, because if we were to imagine that this is a government problem, no, it is not a government problem. It is also a community-based problem. And as I say, you don't imagine the extent at which there's so much could be done even before the government gets into place. And it could take a team of young individuals who can get themselves engaged even better than government officials coming into part. And the money investment is too huge a number for it to automatically become a priority to basically evacuate all this issue at once. Whereas somehow as younger people, when we get involved, we get to see more creative ways to intervene and have a better impact in changing the narratives, in changing the possible positive outcome of this situation, even way quicker than waiting for funding. We've been waiting for that funding. Is it there? No. Is the problem accumulating or getting out of management possibility? Yes. And we're asking ourselves, if we start putting imagine as to what is the time frame we would all want to see these changes, then we should start thinking of how can we become part of that change to effectively make these happen. And there's no way we can do it by ignoring it or not going there to basically see how to engage with the people themselves locally. But it's not going to be an easy task. We see it as doctors, but we're limited as to how much we can do if we're already seeing what the lab is challenged with, what the hospital setting is challenged with. Even within the hospital, we have our own challenges. So we can basically help set up the information, the ideas, and partly help to coordinate it to make it happen. We did it as younger people as well. I did. Well, I grew up partly in the province, which makes me understand how much more could be done, especially in Freetown, because you can somehow even take a few of these people within the community, take them outside of the community, and encourage them to see that perspective differently. I just would not want to replicate everything, as my colleagues have said, as a doctor. I'm trying to also get the communication across as a citizen, if you understand what I'm trying to say. Yeah?
This shows, I think, that you understand very well what this platform is all about. Because you have called them to action in terms of social entrepreneurship and their responsibility as youth. And I think the message is very clear. It's high time we stopped just blaming governments because they cannot do it all. So what in our communities, what is the thing that is disturbing us? What is the thing that humanly we cannot no longer tolerate? So what is that thing and what can we do about it? If we as an individual cannot do it, she mentioned collaboration. Who can we collaborate with? Who can we bring in the community? Even if it's not our communities, then how can we help the Kube community, knowing that we are really at risk if the Kube community is still the way it is? So I think the message is clear, and thank you so much for nailing that down very clearly, because that's what also this platform is about.
Can I mention something?
Please.
Yeah, we also can't blame the slum communities totally, because we have a very poor waste management system. You know, so I guess the government has a very big role to play in improving the health or improving the environment that these people live in, and definitely education, where some of you will come in sensitizing the public, educating them about the health consequences, just especially the current health consequences and the future health consequences.
If I should also ask, one of the reasons why I mentioned collaboration, because I know there's always this tendency of saying, what do we have for what? Or it's not my tribe, it's not my... Please, politics has died ages ago. Let those who want to do politics play politics. Because here, when you go into a community, kids that play with each other don't care if you're Konom, Mende, Creole, this, that, you understand? And for you to interact with certain community, you need a friend that's Fula, you need a friend that's Timini, so the more we come in with that diversity in the group that we form, the more impactful we are, because we take in as youth that we are the next generation of Sierra Leoneans who want to make a change, irrespective of our cultural background, irrespective of your tribal setting, or irrespective of even where you were born. Freetown, not Freetonian, and it takes a community at a time. But if we don't start now, it's not going to change. Our children's children are going to still see the impact, if not worse.
Yeah.
And we see global warming. Do we have an idea how this will be in 5 years? I'm not even going to go 10 years. How it's going to affect our community in terms of global warming? Does anybody here have an idea? No.
I think in 5 years, this is gonna be something of the past. Because I know the Sierra Leonean youth is gonna take action, because there is no way we won't be angry enough for us to just give solutions to this.
Yeah.
And we're looking for money. Everybody's about making money. Money is here.
Yeah.
The waste is money. It's energy. It's like you can get billions. You can become a billionaire just investing in waste management. And why would we, as youth, why would we allow this to continue? Because I think it's like as she said, we are done with the era when people were just looking for white-collar jobs. We should get our hands dirty and try to give solutions to the problems we have. Because if not us, then who? I don't think we will have anybody else. But then, hopefully in 5-10 years, Kube is going to be Kube, Bome, and all the slums that we have in this country will not still continue being a challenge for our public health. That being said, I would like us to without transition, just talk about the challenge that the outpatient services represent for the health system in itself. It's like, as you said, people who have TB go to the hospital, receive treatments, and then just maybe disappear and don't follow their prescriptions or treatment the way they should, and then they come back, either with resistance or they contaminated some of their neighbors or family members. So how can we improve the quality of the service for the outpatient part of the system?
Thank you. Apparently, the key aspect that lacks in our healthcare system is community-based interventions. When we focus on healthcare system, we are more focused on hospital-based for those that are sick. So most of the time, when people are sick, when they are discharged, they go home, there are no follow-up interventions that follow. Usually, if someone is sick, for example, after discharge of that particular patient, you write medications, you write a prescription without follow-up. Then the person will go to a pharmacy, and the pharmacist might be very busy. Or sometimes there is no pharmacy in some of these pharmacies to explain the prescription for that patient. So they go home, take their medication, and then at some point they will stop. Because there is no thorough explanation on how long they should continue. And someone with a condition like high blood pressure, they will come back. Maybe when they come now with complication. They just think the time they came to the hospital with a complication, that complication has been cured. But there are no follow-up interventions that we provide in our communities to explain to those people, to link them back to our outpatient setting so they can continue to get their services. And this is where entrepreneurship actually is very tough. So people can have organizations that will say, oh, I'll work with this hospital, I'll work with this health facility. If you see a patient, you discharge the patient, our own responsibility is to see how we can get information from you on how you want this patient to be followed up, on how you want this patient to take medication. So we can now link the community with the healthcare facilities. But those are lacking. In other places, people are doing it, home visit. They say, oh, I have an organization that is responsible for home visit, that take patients from the time of discharge to the community, and then take that patient back to the hospital when it's needed. Those are areas that we can look at. But even the aspect of social entrepreneurship. In other countries, for example, TB has what they call community-based interventions. People can deliver anti-TB drugs, that's TB medication, directly to patients in their communities. So they take them, they make sure that they get their drugs. So if there are problems with transportation, you solve that problem by your intervention through social entrepreneurship. And people that are funding these programs might be happy if you're able to make a thorough assessment on how this one can provide interventions, impact. So we need to look into all those things. There are some other things that people are doing. If you look at implementation research, they give anti-malaria medications in community. For example, someone at Kube who has a child that is sick might just come to a particular center. They have rapid diagnostic test. Something you can just test. Oh, this is malaria. Take this medication. You prevent the mother from considering that should I go to the hospital? If I go to the hospital, this might cost me. Sits with that child at home until probably that child dies. You solve the problem. So we need to look at community-based interventions to prevent problems that occur in the hospital and outpatient setting. But there are also issues that occur even within the hospital setting. You know, the way we give appointment. Sometimes if you have, for example, a diabetic clinic, you have to go to call first thing in the morning, 7 a.m. All the patients are there. They will wait. Sometimes you see the last patient at 1 p.m. Someone has come from morning, 7 a.m. We don't give a staggered form of appointment. So that's a challenge. And our attitude, the way we actually talk to these people, drive them away. There are very key aspects on our own attitude and our own systems on how we handle them. But entrepreneurs can come in and see how they can work modalities with the hospital setting to see how staggered appointment can be made. So people can come, have the appropriate appointment schedule, take their services or obtain their services at appropriate time. If we don't do that, we are driving people from the hospital. That's why people don't come to the hospital sometimes. They prefer going to somewhere they can just stand at over the counter in pharmacies that I'm having pain here. They say, oh, take these drugs because of this. So we need to look at it at different aspects, at community level for us to solve the issues of our patients, as well as at hospital settings.
Thank you so much, Doctor, for this very clear explanation. It's really very satisfactory for the patient or for the general population, because I think you have touched where it really hurts for the population. You also have mentioned twice the role of the pharmacist, and it's something that I would like Manal to jump on and please clarify what's the role of the pharmacist in the whole health ecosystem, please.
Before talking about that, I guess also because of shortage of healthcare professionals, that's why we're having overflowing or lots of overwhelming number of people seeking healthcare. So the role of a pharmacist is very diverse, and it's a lucrative profession, which I'll encourage all of you to, some of you will be interested to do it. Yes, so pharmacists are generally, historically, pharmacists are believed to be just drug dispensers. But now we're evolving out, and we've evolved from the traditional dispensing role to a more patient-oriented focus. So apart from ensuring that our country have good drugs, standard drugs of the right quality, of the right active ingredients, we're also involved in supply chain, of the supply chain, making sure that the right drugs come into the country for the right purpose at the right time. Also, that involves regulation, as we have the Pharmacy Board of Sierra Leone. Also, we have pharmacies that are involved in the industry in making these drugs that we all take. And pharmacists also play a very big role in education, health promotion. And we also have clinical pharmacists which have a big role to play in the hospital. And that is one thing that is lacking in the country. Because in other developed countries, or where there are more pharmacy professionals and where the pharmacy profession is more recognized, they have a very big role to play in the hospitals to prevent medication errors from prescriptions, drug interactions. They're there to monitor the patient's response to the drug that is prescribed. They're there to monitor adverse drug reactions to those drugs. They're also there to monitor prescriptions in terms of contraindications to these drugs. And also diet. Pharmacists also play a very big role in hospital when it comes to diet, because we have what we call as drug-food interaction. We also have drug-disease interaction. So that is where pharmacists come in. And also, pharmacists are responsible for dosing of medications, also especially when there's liver or kidney problems in the hospital setting and all the rest.
Thank you so much, Manal, for that clarification, because I think the clarification is very important, because yesterday somebody challenged me by saying, oh, this is a pharmacist, she's not a doctor. And I was like, sorry, because I can understand the general population being confused about the role of the pharmacist in the overall ecosystem of the health, of health. Because, of course, their role is not only to sell the drug, but all of what she just has